Deputy Speaker, generally this bill is to be welcomed as it seeks to promote collaboration and the integration of local health and care services. It aims to give local people, local clinicians and those running local NHS and care services more control over the way that health and care services are delivered. The King's Fund highlighted that the bill will remove clunky competition rules and make it simpler for health and care organisations to work together and to deliver more joined-up care to more people. That said, Mr Deputy Speaker, it is important to recognise that over the last 16 months have been very challenging and very exhausting for those working in health and care, and in many respects the last thing that they now need is yet another NHS reorganisation. Groups like the BMA do have concerns, and I would urge the government to look at these closely in committee. Mr Deputy Speaker, there are two issues I would briefly like to highlight. Firstly, from the perspective of the Waveney area, can I urge the government to retain the existing boundaries with Waveney remaining in an ICS with Norfolk? To change the boundaries, to make them coterminous with the two counties, would be highly disruptive, an unnecessary distraction and demotivating for hard-working staff. It would place at risk health integration that has taken place in the area in recent years. To achieve better collaboration with care services, it is better to build on these existing foundations rather than to dismantle them. In many respects, boundary wars have been going on behind closed doors for the past 7 to 8 months, though I'm very grateful to both the Secretary of State and the Minister for State for listening to my concerns in recent weeks, and I urge them to retain the status quo. Secondly, the health issue that has taken up most of my time in recent weeks is NHS dentistry, or rather the lack of it. Many of my constituents are in agony, and local NHS dentists urgently need the funds to see more patients. I think that we are gradually moving towards a short-term solution, but this has taken far too long. Longer term, there needs to be greater accountability. Dentists need to have a voice on integrated care boards. Dental budgets should be protected, and steps must be taken to tackle the staffing crisis. In conclusion, Mr Deputy Speaker, this bill provides a statutory footing to ways of working that in many respects are evolving naturally. However, there are potential pitfalls, particularly from my own perspective, changing ICS boundaries, and I would urge the Minister to avoid this at all costs.